Stroke, heart attack, craniocerebral injury. Every minute, every move and every decision counts in cases of an emergency. The University Medical Center Hamburg-Eppendorf is very well prepared for medical emergencies. Anesthesiologists, surgeons and internists work hand in hand in the central emergency room. Distances are short. Helipad, trauma room for initial treatment, examination rooms, operating theatres, everything lies close together.
After trauma, we are mainly preoccupied with the preservation and the restoration of injured bone, joints, soft tissues and organs in our patients, especially after multiple injury, that is polytrauma, in pelvic and spine injuries, in osteomyelitis and bone tumors, and finally in major surgery of big joints. Our surgeons rely on cutting-edge medical development and techniques.
The outstanding technical standards and worldwide renowned physicians contribute to the UKE standing as one of the most famous clinics in Europe, both for inpatients and outpatients. From pregnancy and childbirth onwards, the expertise and knowledge of a good medical team pays dividends. Especially during difficult pregnancies and births, our team sets the standards. Our team was decisive in the introduction of a highly effective minimal invasive laser treatment for treating the under- and oversupply of blood to identical twins while still in the womb, known as twin-twin transfusion syndrome. Next door to the delivery room, we have a large intensive care unit offering 12 monitoring beds for ill or premature newborns. Here we are also able to treat those babies who are born extremely prematurely using the most modern methods and technology available. Around the clock, these smallest of patients receive the specialist and loving care they require. After discharge, we continue to provide a high level of aftercare at our specialist aftercare outpatient clinic. At the University Heart Center, we treat both children and adults with congenital heart defects and vascular conditions. The teams under Professor Hermann Reichensporner and Professor Thomas Meinertz work using the latest advancements in medical research and technology. An ever-increasing number of interventions are carried out using minimal invasive and endoscopic techniques or approaches which provide access using a heart catheter. Imaging machines are becoming more and more advanced and provide us with highly sophisticated images. Deciding factors remain teamwork, innovation and high-performance medicine.
At the University Heart Center Hamburg, almost all patients are seen together by cardiologists and cardiac surgeons in order to determine together the best diagnosis and treatment strategy for the individual patient. Modern technology is used for almost all heart operations. In the majority of cases, we use minimally invasive or even endoscopic procedures in order to minimize the operative trauma for our patients. Heart valves, by the way, can very often be repaired these days in order to avoid the replacement of the heart valves.
The UKE is constantly conducting research to improve available treatments. Professor Thomas Eschenhagen and his team are currently working on the development of artificial heart tissue.
Myocardial infarction destroys heart muscle cells, and this loss of myocytes is essentially irreversible and leads to heart failure. We therefore try to replace lost cells by new cardiac myocytes, and this can be done either directly by injecting these cells into the tissue or by engineering heart tissue and implanting these tissues after myocardial infarction. We develop the second approach and hope that one day the engineered heart tissue can replace enough of the injured myocardium to make the heart beat stronger again.
Researchers have an extra campus research facility. Researchers and scientists from all over the world work at this facility, leading the way in research of lesser-known conditions and the improvement of existing therapies. Biological processes are deciphered, the mechanics of certain illnesses decrypted, and new effective therapies developed. Our research is carried out always with the well-being of our patients in mind. The Hubertuswald Tumor Center at the University Cancer Center Hamburg, our doctors and researchers are at the forefront of the development of new types of tumor diagnostics and new ways of combating cancer. Our findings are then used to treat a wide range of different cancers. Cancers of the inner organs, the hemopoietic system, testicular cancers, malignant tumors of the gastrointestinal tract, cancer of the connective tissue, the lungs, as well as craniocervical cancers. The successful collaboration of experts of a wide variety of specialist fields who conduct regular meetings to discuss complex individual cases has led to the Hubertuswald Tumor Center being recognized as a nationwide leader in the field of oncology.
Every patient seen at our cancer center will be discussed by a multidisciplinary team of special cancer physicians. By this means, we ensure that every patient receives the optimal individual treatment of his disease, commonly agreed by medical oncologists, surgeons, and radiation oncologists and other disciplines involved in his care.
Our transplant center enjoys an excellent reputation in the fields of liver and kidney transplants. We also carry out transplants on children and living donor transplants. The combination of speed, precision, and, once again, the collaboration of an expert interdisciplinary team guarantee the high level of medical treatment and care. Our Cranial Neurology Center has made a name for itself in the treatment and researching of vascular conditions, for example, strokes. Teams of experts provide optimal therapy for chronic headaches and patients requiring other forms of pain treatment. Patients who suffer from highly complex illnesses receive treatment on our Neurology Intensive Care Unit. We also focus on the treatment of patients suffering from multiple sclerosis and conditions affecting mobility, such as morbus Parkinson.
Just 10 years ago, stroke was considered a hopeless situation. By the introduction of special units, like stroke units, such as we have here in our hospital with 12 certified beds, the risk of death or disability could be reduced up to 42%. About 20% of our stroke patients are younger than 45 years of age. This shows that stroke is not a disease of the elderly only, but it can affect anybody at any stage of his life.
Stroke patients are immediately assessed and receive the necessary therapy at our stroke unit. We start with the early stages of rehabilitation right away. The importance of interdisciplinary collaboration of stroke experts cannot be underestimated. Our highly trained and specialized nursing staff play a decisive role in the care we offer.
Especially for patients who are severely ill and their relatives, it is of the utmost importance to have someone they can turn to with any questions they may have with regard to the condition of their loved one, the treatment, or to discuss the discharge of the patient. We work according to the primary nursing method. This means each patient has a contact nurse that cares for him for the entire duration of their stay.
The food is provided by specially trained service personnel. Therefore, our nursing staff has more time to care for, mobilize and, not to be forgotten, talk to the patient. Men from all over the world come to the UKE Martini Clinic for treatment. The team at the Martini Clinic specializes in prostate-related interventions. The clinic is world famous for the procedure in which the prostate is removed, but the nerves remain intact. After the operation, most men remain continent and do not suffer from impotence. Professor Margit Fisch is responsible for all conditions affecting the kidneys, bladder or testicles.
Surgery of the urogenital tract is challenging, especially in children. Congenital anomalies of the kidney, the ureter, the bladder, but also the external genitalia may require surgical intervention. For the very young and small children, we use microsurgical techniques.
At our pediatric clinic, our young patients receive special care. The clinic is specialized in the diagnostic and therapy of complex illnesses and works together with the Altena Children's Hospital, which was taken over by the UKE in 2004.
We have built Europe's most modern hospital. It provides a whole new world for the interaction of physicians and nurses from various different departments. Their collective knowledge and competence is being brought to bear for most optimal patient care. At the same time, it is the basis for innovation in medical school training as well as research.
The University Clinic Hamburg-Eppendorf can look back on a 120-year history of success. Now, with the new medical center, the new research campus and the new teaching campus, we are laying the foundation for the continuation of this success story. We are currently building new facilities for both the pediatric and psychiatric clinics to help us to continue to provide the highest level of medical care.